So now moving on to solutions and treatments for rosacea.
So rosacea is a condition which can run in the families. So people who have rosacea, I
I
mean,
have
they just know
rosacea.
how I can see that. So first thing first, you need to cut out everything that is hot, whether it is temperature hot or hot spices, anything that causes flushing is what you stop.
Hmm.
For example, in your alcohol, I wouldn't like you to take a brandy or a whiskey or a red wine, which causes flushing. So you take alcohol, which doesn't cause flushing. In your diet,
Right.
you don't use too much of green chili and red chili or peppers, which just spike your skin and then make it become too red. So you also in the food substances cut off the inflammatory food like sugar. So these then
Mm.
in the diet format itself gives you a lot of relief because this is a condition which is ongoing, right? So you need
Yeah.
something even in the diet to kind of help you.
You need to
And
make
then the
lifestyle
temperature.
changes.
Exactly. And the
Right.
temperature itself, wherein you end up not having too hot a coffee or tea. Even if you want to have something hot, don't let the steam just come up on your face. Like have a sip and put it away. I see a lot of
Hmm.
people discussing with a cup like this where they've had, and it's like this, where the steam kind of keeps coming on. So you put
Yeah,
that away,
that's really
especially if
bad.
you have rosacea. Yeah. And then when you do the gym, you don't end up going into the
Mm.
steam room because that again on the face causes, flushing. So if you have to go to a steam room after the gym, use a cold towel on the face. And when you wash your hair, don't use too hot water to wash your hair. So these are a few lifestyle changes that might really, really help you. Other than that, there is enough studies showing now it is not the same thing that causes acne is what causes acne rosacea, is what we thought, right? But it is not
Mm.
the same pathogen. What we know now that it is a mite which causes it called Demodex. So the treatment for
Oh.
rosacea acne is not necessarily the treatment for acne. So there is ivermectin, which has given fantastic results when we apply. There is something called azelaic acid, which gives you fantastic result in terms of cutting down the redness and the acne that happens. So these are applications, of course, which your dermatologist may have to give you. But
Right.
these you need to know as a knowledge that this is what's the latest, what's happening in science.
Right. And so the treatment for rosacea would be topical, or would you need a procedure, like with creams
You
and
might,
stuff, or
procedure maybe not right away, but two things you'll always need. Some topical, depending on the stage of rosacea, you may not, or you may also need oral medication. So topicals,
mm,
like I said, more of azelaic acid, ivermectin, metronidazole. These were the things that we were using as topicals. Depending on what
mm,
your stage is and how bad or good your rosacea is, the doctor might choose what to
right,
give. What's important also is for you to hydrate your skin so that the skin's barrier function is kept intact. So you should look for
right.
ingredients like ceramides in your skincare cream, calming ingredients, maybe like a calamine. So these are things that will help you to apply.